Hello, everybody, and thank you for joining the webinar today. Today is the first webinar in our Twinning Programme series. And so we look forward to sharing knowledge and best practices with yourselves. And we really want this webinar to be as interactive as possible. So we will first have a quick introduction by Nebojsa Lalic about the webinar series. Then Martina will give us an introduction to the Twinning Programme, and then we will have 5 presentations from each one, from 5 different member associations, before giving the floor to everybody in a Q&A session. So without further ado, I will let Professor Lalic introduce the webinar.
So thank you, Sabine, and welcome to everybody to this series of webinars, I must say, which is in fact the result of our intention to intensify the collaboration between our member associations, which we considered especially in the last couple of years, as very important. You know that IDF Europe had always a number of activities, but they were grouped either around some anniversaries or World Diabetes Day on one side, or on the other side, some of the activities within European Parliament and within different other governing structures in order to improve the position of the people with diabetes. But somehow in this activity we realized that we have in a way, it would be too rude to say neglected, but put in a second plan the communication among our member associations, and we did not use the possibilities of exchanging experiences and go further on towards maybe some joint activities between the countries that have developed the similar methodology, and however that exists, and you will see that during those webinars. So this year we just wanted to give a special attention to that, and that's why I invite all of you to be very interactive and to react to the presentations, and to maybe put the ideas on the table about how this collaboration might look like. So it is not my lecture. Thank you very much, and I'll now give floor to Martina, who's going to describe how the twinning projects are going to work.
Thank you, Nebojsa. So Martina, I'm sure that everybody knows her from our office. Martina is in charge of the Twinning Programme. So she will now give a few words about the program.
Yes. Thank you, Sabine and Nebojsa. And hello, everyone, and welcome to the first of a series of webinars for our member associations. In today's agenda, I will first briefly introduce the IDF Europe Twinning Programme for any of you who might not know it very well yet. And then we will go ahead with 5 presentations from our speakers today, who will be telling us more about various initiatives on primary prevention of diabetes that have been or are currently implementing in their respective countries. At the end of the 5 presentations, we will have a Q&A session in which you can take the floor and ask any questions you might have to the speakers about the initiatives they presented. So about the twinning program, this is a project that we launched early last year with the objective of helping our members to strengthen their capacity by exchanging knowledge and expertise with each other in certain areas. Being these areas that might be more operational, such as the management of the association, like raising funds or recruiting volunteers, but also the key areas of their activities, whether this can be diabetes education, prevention, or advocacy. And a parallel objective is also to subsequently strengthen the connections between the members of our network. So we really want to help everyone connect, exchange their expertise, and eventually strengthen the impacts of their activities at the national and regional level. The ways in which the twinning program has taken shape over the past year are essentially three. From the very beginning, we set up one-on-one collaborations in which an association which has a lot of experience in one particular area is supporting another one who may want to improve their activities in their field. And in regard to this, this is a type of collaboration that is still ongoing. And if you would be interested in joining and being matched with another association to maybe work on a common project, you can let us know and let us know what you're looking for, and we can help you to set this up. So later I will share in the chat a document with more information on how to set up these collaborations and how this works in practice. And I will also share the results of a mapping survey that we conducted last year, which can give you a more general overview of what are the main areas of expertise of the other associations, so you can understand where they could provide support to you. Then another format, as you might remember, in December during the Regional Council, we organized some breakout sessions in which our members could gather together in groups and exchange some suggestions and ideas on certain topic of interest. And finally, what we're launching today is the new format, which is consisting in a series of webinars. The way these webinars work is that each webinar will focus on one particular topic, and about 4 to 5 associations are invited to share their experience on that one topic. And follow this webinar, we will also take these presentations and develop the sort of case studies about the initiatives presented. And we will share this with all our members so that we can start building a sort of repository of best practices from which other associations can maybe take inspiration or potentially even replicate them in their own countries. The topics of these webinars are identified through consultations that we have with our member associations, and especially through the mapping survey that I mentioned before, which served us to better understand what are the need and strength areas of our associations. But of course, as we go on with the program, if anyone would like to suggest additional areas to explore during a webinar, we're very happy to include it in the list. As of now, the topics we identified for the coming webinars will revolve around secondary prevention, the engagement of people living with diabetes, diabetes education, advocacy with regard to access to medicines and technologies, but also health system reorganization and membership development. So with this, I think we could start with today's presentations. The first one will be from the French Federation of Diabetes, and we have Alexia Gervais, who is the development officer of the association, and she will be presenting on their primary prevention week in France. So Alexia, I leave the floor to you.
Thank you, Martina, and hello, everyone. I'm happy to be here and to share our experiences during the National Diabetes Prevention Week. So I'm Alexia Gervais, and I've been working for the Federation for 2 years now. We are based in Paris, and my role at the Federation is to contribute to and to implement national projects like the National Diabetes Prevention Week, with following up with local associations The French Federation of Diabetics is a patient association which has existed since 1938, and we operate in 3 key fields. The first one is the information, support, and preventative measures. The second one is the defense of the individual and patient advocacy, and the third one is the research and innovation. So in 2012, the Federation created the National Diabetes Prevention Week to embody its mission statement of commitment to information, support, and preventative measures. This event is held every year and aims to inform the public across the nation about diabetes and its risk factors. In France, diabetes affects 6.13% of the population, but estimates put people currently unaware that they are living with diabetes around 700,000 individuals. So in France, we have 4 million people live with diagnosed diabetes in France. Can you move to the next slide, please? Thank you. People suffer from a lack of information on the principal risk factors increasing the risks of type 2 diabetes. The lack of information manifests itself in a couple of ways: a delay in the diagnosis, the discovery of the illness through symptoms rather than through proactive checkups, and the non-compliance with dietary requirements. That is why the main objectives of the week are to encourage people to adopt prevention behaviors through healthy diets, physical activity, and to increase the knowledge on diabetes. And in addition, we want to give the visibility of our network, which are the local associations and all the volunteers, to put the Fédération as a frontline player of the prevention in France, and we want to mobilize all the health actors concerned. Here on the screen, you can see the last 3 years. In 2021, on the left, the National Diabetes Prevention Week was based on the cardiovascular risks. In 2022, in the middle, we can see the other week, and it was based on the smoking-related risk factors. And this year and next year, the National Diabetes Prevention Week is based on the risk factors caused by a sedentary lifestyle. Next slide, please. Thank you. The Federation creates toolkits for its local associations, and it's in the field that these associations meet the general public. The toolkit, is made up of flyers, press releases, tools for website, banners, visual displays, podcasts, etc. Next slides, please. Thank you. We use key performance indicators to measure and monitor the success of the initiative and to support its objectives, with actions in the field, with the mobilization of local association and mapping on the website. We use the fine risk test and the traffic on the Contre le Diabète website. The idea is to know how many people visited the website Contre le Diabète, and it encourages people to come forward to be tested, and it reminds them what key message we have. We also encourage them to download the communication kit and identify the cities organizing actions themselves. There is also the press impact through quantitative and qualitative impact reports, the regional daily press, media mapping, potential audience, etc. And we also have the social media results. and it's including the posts by various partners in LinkedIn or Twitter, this kind of social media. Next slide, please. Well, the Federation works with various types of partners. The major and institutional actors are, the institutional actors are the Ministry of Health and the Assurance Maladie, but we also work with the local communities, and it's including more than 207 mayor's offices to relay the campaign. We also have our pre-existing stakeholders like the National Union of Cardiology, the Francophone Diabetes Society, the food banks, les Restos du Cœur, etc. And we also have our local association, which we are proud to call our own network. Next slide, please. Yes. Thank you. And yes, we have also a budget dedicated for this week between 150,000 and 200,000 euros. And the commitment with the Health Ministry and l'Assurance Maladie as to our project and our long-term relationship is renewed once again through continued financing and support. About the main challenges or barriers, I can say that one of the main challenges is the budget management, mobilizing the network for a collective goal. As the National Diabetes Prevention Week is a big project, it's crucial to plan and anticipate the needs for our network, so the local associations. And we need to be able to adapt to exceptional circumstances. For example, this week in 2020 and 2021 were in September instead of June because of the pandemic. And another big question is also how to reach a wider audience, in particular with social media, because usually we reach people already living with diabetes. But during this week, we want to change our focus and outreach the general public. Next slide, please. Thank you. So the main opportunities contributing to the success of the initiatives are how year after year we engage new stakeholders, generating more income for its just cause, and our own network that makes the success of the campaign. Next slide, please. Thanks. What about the main results of the initiative? I can say that making diabetes known by raising awareness, because it's important that everyone understands their individual risk of diabetes. The traffic to the website climbed higher and helped extend to impact of the campaign. And this week optimizes the visibility of risk factors. Thank you. And for this slide, I would say that it's a big job in terms of logistics between the federation's different teams, but also transparency is crucial. The paper trail and decision-making process on all ends and for all different concerned parties must be made clear. Public relations are extremely important as positive media opinion is key. And budget optimization is also a key through careful planning and surveillance. Thank you so much.
Thank you very much, Alexia. Very inspiring campaign. So as Martina mentioned, we will keep the questions to the end of all presentations. So thanks again, Alexia. And now we will hear from Sari from the Finnish Diabetes Association. Sari, the floor is yours.
Yeah, thank you. I will share my screen. And can you please confirm that you will see my presentation?
I can see it, yes.
Okay, thank you. So I will tell you about type 2 diabetes primary prevention initiatives in Finland. I'm from Finnish Diabetes Association, and we are an association of both patients and healthcare professionals. My name, I will share you with a continuum of type 2 diabetes primary prevention initiatives, successes and challenges. And I'm Sari Koski, and I'm development manager in Finnish Diabetes Association. So I will walk you through with these initiatives within quarter of a decade of primary prevention in Finland, starting 2000 and ending this year. So the mother and father of primary prevention initiatives in Finland is DEHCO and its prevention program D2D. I think one of the most known result.
Sorry. I'm not sure your slides are moving with you talking. So
they are not.
No, I don't think that we're not seeing them move. We're still on the first slide.
Okay, maybe we'll do that. Maybe Martina can share my screen.
Share my slides. I can share it myself.
Yeah. Sorry.
Just a second. Okay, can you see it?
Yes, you are on Alexia's last slide.
Yeah, thank you. Okay, let's start again. You can skip my next slide here and take the other one. Yeah, let's take another one, please. Thank you. So this is DEHCO, which is kind of mother and father of our primary prevention initiatives. And I think the most known result of DEHCO is FINRISK type 2 diabetes risk test, which is very widely used in Europe. Next slide, please. A couple of years earlier, before DEHCO, we had discovered with DBS and DBP that it's possible to prevent type 2 diabetes. And DEHCO was followed by the IMAGE project, where also Finland attended. The Take Action Prevent Type 2 Diabetes project was followed by the GOAL lifestyle implementation trial. Next, please. 2012, we started our joint effort with Finnish Heart Association and Finnish Brain Association to promote vascular health. Next, please. And when coming to near 2020 in Finland, were two research programs. VESOTE was program for effective lifestyle counseling, and STOPDIA to find out a model supporting healthy lifestyle in the society. And the next one, please. At the moment, we have Pathways to Wellbeing program, which aims to provide people with diabetes and those at risk developing type 2 diabetes open and easy to use information to support the lifestyle changes. Next one, please. So about our initiatives, goals have been first to recognize people at risk of type 2 diabetes. That's why this FINRISK tool, and to create awareness about type 2 diabetes in Finland. After DEHCO, it has been more or less a goal to find the best ways to support people with healthy living habits, both individual and social level. So over the years, there has been a variety of key performance indicators. The number of new cases of type 2 diabetes, participants' weight loss and amount of performed exercise, effect of lifestyle counseling, support of health promoting behavior to lifestyle changes individually, and also the effect of nudging. So target audience of the initiatives has always been people at greater risk of developing type 2 diabetes. And we have found out that it's somewhat easy to reach out middle-aged women, like 55-plus-year-old women. But what about others? Next one, please. So I told you about many initiatives, and they have followed each other, but they have always been built on the previous ones. To take all that has been successful about previous initiatives, but trying something new. So there has been many stakeholders in implementation of the initiatives. Finnish Diabetes Association have been a key stakeholder with several of them, but also has at least collaboration in all of them. Some initiatives have had a key stakeholder universities or Finnish Institute of Health and Welfare or like that, but Finnish Diabetes Association is regarded to have a major impact within development of type 2 diabetes primary prevention in Finland. Also because the stakeholders have been varying, the financing of the initiatives have varied. Some of them has been financed by social welfare and health organizations in Finland. Some have been financed by the Ministry of Social and Health, and some have had industrial sponsor money. Some have had grants from EU. Next one, please. So what are the challenges and barriers of our initiatives? At the beginning of initiatives, when we started DEHCO and its prevention program, the amount of people with type 2 diabetes was rapidly growing, and it was like a friend just said that we must understand that there are a lot of people with type 2 diabetes without knowing it, without diagnosis. And when you start to recognize who has the diabetes and get them to the care and treatment, so it's kind of funny that you have a prevention program, but the amount of people is rapidly growing. So that's something that you must always talk through about decision makers. How come is this possible? Also, challenges and barriers are to reach out for the right people, reach out of them who really are at greatest risk of developing type 2 diabetes. And not forget, you must also reach out for men and people under 50 years. The main opportunities contributing to the success has been cooperation between different stakeholders, and also I can't address this most enough, that strong support from national level stakeholders. And at now we are talking in Finland about pricing and taxes and sugar taxes and like that, that it has a huge effect if we are incorporating these like things. So the main result, I think the greatest result is the awareness of type 2 diabetes and the prevention possibilities of these. And what are the learnings to share? I say that we in Finland, we still have people at risk despite all these initiatives. There still remains people who has been informed. They know that they are at the greater risk, but they still have their own choice and will. They just don't want to do anything about that, and it doesn't matter anything for them. And the second learning is that you it's best if you have multiple choices for people where to join and what to try, because one size really don't fit all. And the last learnings to share that it is crucial to attract the media. If you can get the media interested in your initiative, then it's multiplying its possibilities and who are you targeting and who are you reaching out. So thank you. This was everything from me.
Thank you, Sari. This looks like a very comprehensive program, actually. So I already have questions, but we can address that at the end. We will now hear, so thanks again for the presentation, and we will now hear from Robert from the Slovenian Diabetes Association. So Robert, the floor is yours.
Hello to everybody. I am Robert Breton from Slovenian Diabetes Association. We are association of patients, and we are working from 1957, so we have 65 years. I will share with you something about school competitions on diabetes knowledge. Next slide, please. What was the goals of these initiatives was to raise awareness about diabetes, recognize the science of diabetes, recognize the facts, course, and characteristics of diabetes, know the complication, and then learning the importance of healthy food and importance of regular physical activities. I made these slides into parts. You can see in the bottom, you can see some of the questions we are used that are used in our competition. So you will make one idea how difficult or not difficult it's this competition. Next slide, thank you. What is the indicators of measurement of this program is the number of participation in school competitions directly and indirectly. So the pupils and students, teachers, parents, and grandparents. We have each year about 10,000 pupils and students who compete on this program, and about 400 schools, elementary and high school. Next slide, thank you. The target normally is children from 11 to 14 years of age in elementary school and high school students. We don't go under this year because it's not applicable to younger children. Next, please. We organize this program each year, once a year in time frame of 30 to 60 days, as seminars for teachers, school competition and national competition. We have two levels of competition. In school competition is allowed to every pupil and students. Like I said, they are around 10,000 every year, and they who reach the determined number of points can go to the higher level. It's a national competition. We have each year around 300 to 400 competitors on the national competition. Next slide, please. This initiative is implemented, it's carried out by the Slovenian Diabetes Association, but we have help of the professionals, diabetologists, dietitians, ophthalmologists, sport professors, because when you must have the right questions and also most important, the right answers. And for this, we are taking help from the professionals. Thank you. Next slide. Yeah, the program is financed from project application and sponsorship fund allocated to the project. Normally, this is FIFA is a foundation of invalid and humanitarian organization who is founded by lottery, Minister of Education from time to time, and normally various companies who is interested in this project. Thank you. Next slide, please. The main challenge that this program reached at the beginning, I cannot answer this question because this program is old 24 years. This year we will have 25 years of competitions, but I can share you what was happening when the time of COVID was. Normally, we run the national competition as the event of at schools, which requires a lot of organization and coordination. And it was placed in 3 different parts in our country, but with the COVID restriction, this was not allowed. So we prepared a national competition online through online channels that we still use today for a national competition. Next slide, thank you. What is the main contributing? The goal is to familiarize the young people with prevention and healthy lifestyle. The content of the competition was also accepted by teacher and professor as part of the learning materials suitable for life. Normally, this is we are working on this program with young people, in elementary and at high school, and this was our goal for this initiative. Next slide, please. Thanks. Yes, like I said, the main result of this program can be seen in the long term because participants, both students and teachers, transfer knowledge about diabetes first to their home environment and then outside this environment. And after all, this knowledge accompanies them through their lives. And normally, if you learn something in a young age, it's supposed that you take this in your higher age. Thank you. Next slide. What's the learning suggestion if someone wants to share or organize this initiative? Normally, the hardest part of any project is getting started. But first, the first thing, search the area if there is any interest in such program. Because if there is no interest, it's useful to start this program. Obtain the financial resources. This is very important. Start with smaller number of participation because we found that it's easier if you start with smaller numbers. I don't know, 20, 30, 40 schools, maybe 50, 100, 200 participants, and then through the years you will grow up. Invite experts. You will need experts, like I mentioned, for the questions and for answers of the competition. Invite also Minister of Education, insurance company, company in health, in medicine or whatever, because if you have help with the implementation and support the project, it will be easier to go further. At least, not less, do not give up at the face of initial difficulties and continue to work on that. Yes, if you are stopped in the very beginning, you know, it's difficult to start, but you must go through and work on that. That's my presentation. Thank you for your attention. And if you need some other information, I am available for you. Thank you.
Thank you, Robert, and congratulations on reaching a 25-year milestone. It's quite a long-running program, so that's a testament, I suppose, to its success. So thank you. Thank you. We will now hear from João Raposo from the Diabetes Portugal Association. So, João, please.
Thank you, Sabine. Hello to all of you. And I'll try also to share my presentation. Let's see if I can do it in this way. Yeah. I think you can see it now, hopefully.
We can see it, yes.
Okay, thank you. So first of all, congratulations. Well, I'm part of the board of IDF Europe, so it's not so, I don't know, appropriate to say congratulations to IDF Europe, but at least I can say congratulations to the IDF Europe team, especially with Martina and all the people that have been working for a long time on this twinning program. And as you said, Sabine, my name is João Raposo. I'm the clinical director of the Portuguese Diabetes Association, which is founded in 1926, so probably the oldest diabetes association in the world, 97 years of history. And we are also supposed to say a little bit about what we do here. And so a part of the traditional roles of a patient association, creating awareness in the society, promoting the rights and duties of people living with diabetes. We have different aspects of the patient association, since we run an outpatient clinic for people living with diabetes type 1 and type 2, promoting integrated care and promoting the best care for people living with diabetes, trying to set the pace for the best care at national level. We also run a diabetes school, and that diabetes school is to promote education for healthcare providers, for people living with diabetes, families, and in a general way for all the people living in the community at national level. We also have a research center conducting a lot of research, either at fundamental, clinical level, epidemiological level. And we have also quite a strong role on the intervention studies at community level. And that's where that primary prevention trials also apply, a part of trying to promote local groups of people living with diabetes in a way that they can support themselves in managing in the best way diabetes. What I bring to you now, which you can see there in Portuguese, não há diabetes, Desafio Gulbenkian, and it's a story that either you can see it as a half full or half empty glass. And I hope you'll understand that by the end of this communication. So in direct translation, it means no to diabetes, Gulbenkian challenge. And Gulbenkian, it's the name of one of the major foundations here in Portugal, not only related to health, it has a lot of cultural, scientific works, but in 2014, they promoted a document, national discussion on health challenges for Portugal. And from those challenges, 3 of them were considered the most important, and one of them was on diabetes, considering the high prevalence in Portugal and the associated costs either to people living with diabetes, but even the higher cost that costs to the health system and to society in general. So we know that diabetes is a huge problem all around the world, but here in Portugal, we have almost 14% of the adult population living with diabetes, and it represents in the expense 10% of the health expenses, and still we don't have these numbers quite updated with the newest pharmacological innovation. And we also have, and I'm sorry you cannot see, but it's possible nowadays that all case scenarios are possible when predicting the future. Either we can say that it will increase, maintain, or if we succeed with diabetes prevention, we would attain quite a reduction of the number of people living with diabetes. And so this challenge was a response to this public health challenge, the growing epidemic of diabetes in Portugal. And it resulted from the partnership of different entities that you can see on the bottom of this slide, either from the foundation that I've just mentioned, from our government, including the Ministry of Health, of the Portuguese Diabetes Association, Health General Directorate, pharmacies, local authorities, scientific societies, pharma companies also sponsoring this, and support of a significant number of entities in the civil society. It had a very target number, so it aims to stop the growing incidence of diabetes, prevent 50,000 new cases of diabetes in a 5-year period. And we knew that we started with an annual incidence of around 800 people per 100,000 people living in Portugal. And we defined several strategies for this primary prevention program. An implementation of community-based prevention interventions. I'll speak a little bit later on that. Risk stratification of the target population, and we use the tool that was already mentioned by my colleagues of the Define Risk tool. And then we had already developed a program called, in Portuguese, Gosto. Translation, it's like it, I like it. It's an educational program for prevention of diabetes, including a motivational tool to adopt healthy lifestyles and reduce the risk and prevent diabetes. But we had also other goals. So the focus was on diabetes, on primary prevention, but we all knew that when implementing this kind of strategy, we would promote probably more people with diagnosed diabetes, because as Sari mentioned, when we try to prevent diabetes, you always find people already with diabetes that were not aware of their diagnosis. And with that, probably will have better clinical outcomes for that population. We would have more initiatives in the community. We would have more data for management and the development of health policies. And with the training programs, we would have a working force, a health workforce, better qualified either for primary prevention or for dealing already with clinical diabetes. So just to tell you a little bit of the numbers involved and the specific targets for those 5 years, we will include 160 municipalities, our local governments. That would mean to screen a little bit over 1.5 million people, 25% of the adult population of those target municipalities. We would, based on previous results of a national study that we have conducted, we would expect 400 people identifying as having an increased risk. And considering that from that population, 10% would annually progress to diabetes, if we succeed and we consider, based on DPP, efficacy rate of these programs of 50%, we would prevent 50,000 new cases of diabetes that I just mentioned 2 slides before. Just to have an idea of my country and the interventions, as you can see, well, on the left side, it's where we have, on the left, and in the bottom part, it's where we have the water. Around us, the rest is Spain. Most of the population in Portugal live on that left side of our country, that's by the sea. But as you can see, we have municipalities all around the country. And the challenge was composed of very different components. And so first one was how to involve these main stakeholders. As you can see, we have the foundation that was promoting and giving financial support. We have companies to monitoring how the program was conducted. We have the operational management from the Portuguese Diabetes Association, APDP. We had several facilitators, as you can see, and we have the local implementation. And as you can see here, local implementation was the task for municipalities, for pharmacies, and for the primary care teams. And as also Sari mentioned before, in Finland, when they also were part of Image project, we in Portugal were also part of that project, and we had a large training on diabetes prevention management for those municipalities. So the chronogram was complex, as would expect for this dimension, but we defined the setup. We fight for having the larger number of municipalities involved in this process, and then the definition of local teams, a training of diabetes prevention manager, definition of a local action plan, and then training the trainers for the healthcare providers, and then going to action, implementation of local action plan, perform the risk assessment, define the strategies either for the population with low risk or increased risk, and with also the definition of if we identified people with pre-diabetes, what kind of programs would be offered. And of course, we have defined also this evaluation process with all the necessary outcomes to be measured. So this is just an example of the flow chart, and I think this presentation will be available for people. And then if you want to have more information on it, because I don't have the time to go on detail on this, but happy to, in a later stage, to discuss with any association that wants to know more in details. But we define this information flow process because this is a key element. Again, it's another challenge in this process is to define how information flows from the risk assessment to the primary care consultations, to the prevention program, and for the follow-up. And there are some unique characteristics of this program that we found as unique. So the implementation of this program, like it, Gosto, where we have train the trainers. So a 7 hours program with face-to-face and 7 hours in e-learning. So remember, this was before COVID and we were already training in B-learning system. And the referral circuits between the pharmacies, the community, and the primary healthcare center was quite innovative at the time for us. The implementation of these diagnostic consultations and the tests and the consultation, the implementation of these programs at primary healthcare facilities. Again, it was quite a challenge. And the creation of these monitoring tools to assess the efficacy of this program was also something very difficult to attain. Just to have a glimpse on the training programs of the diabetes prevention manager and the topics covered, as you can see, the objectives and those were for municipalities and healthcare professionals. It was exactly the same program for any of these entities, but was just to provide basic knowledge on diabetes and help them to develop initiatives and projects on healthy lifestyle and primary prevention on diabetes at their own communities. Then the trainers of the program like it. Again, the objectives were the acquisition on basic skills on implementing this program. And the idea was to have 10 to 25 healthcare professionals from the primary care centers and adapt this program to their own reality. And then the program GOST. So the idea was to have 5 to 10 people with high risk to develop diabetes, and during a year, do some kind of follow-up with 8 sessions face-to-face, help them to acquire basic knowledge and skills, and to enable them to manage and improve their lifestyle, reduce the risk of developing diabetes, and providing some motivation and address their barriers and help them to succeed. As was mentioned before, communication is always important, and so the website, trying to have some nice image to promote the relevance of eating well. And just remember, people, that it never happens only to others, like diabetes. Assess your risk and say no to diabetes. And just about physical activity, it's never only 5 minutes. Small changes, large differences. Increase your physical activity and say no to diabetes. Just some pictures of the training, either from the healthcare professionals on the diabetes prevention managers also on the program GOSTO, and when we implement it at local level, involving people at high risk and trying to also to promote a high-level communication either at local, regional, but also at national level, trying to promote adherence of this initiative. So I told you at the beginning, this is half full of empty glass. It was easy to apply the screening tool in primary care. By the end of the project, we have almost 1.5 million people screened, and nowadays this number has increased. It's still in place, and almost 3 million people have their risk assessed. It was easy at that time to involve municipalities because they were going to have elections in a very near period, and so it was something they would like to show to their community that they were involved in this project. It was a little bit more difficult to train the diabetes prevention manager because it was just to assign new tasks to people that were already feeling the burden of their current activities. And it was especially difficult to mobilize the resources at primary care for the lifestyle intervention. It was too difficult to integrate the IT system with these new pathways that were needed for the project. And it was very difficult at that time to involve the health ministry structure. So this program finished at that time because it was not possible to attain the involvement of the structures of the health ministry. But nowadays, all that training is still in place. Healthcare providers try to continue that initiative at local level, but for us, it's almost impossible to have a big picture of the impact of this initiative at national level. With that, I thank you for your attention, some picture of APDP and the people working here with me at the association. Thank you.
Thank you, Joe. That certainly seems like quite a big endeavor to put all of this in place. So thank you very much for sharing. And now we're being joined by Cristina Petrut from Romania.
Thank you so much. So first of all, hello, everyone. So happy to be here, and thank you so much for inviting me. Congratulations on all the hard work you've done, and I think that this project really can bring us all together in order to learn from each other, because at the end of the day, we do have the same purpose. And also congratulations for all the wonderful projects you've done. I'm quite amazed. I've learned so much today, so thank you. I will share my presentation if I can. Just a sec. I think that there's the one. Can you see it?
Yes, but not in full mode. Yeah.
And now?
No, that's it. Yeah.
Okay, wonderful.
Perfect.
So I will be telling you a bit about the Romanian diabetes prevention law. I'm Cristina Petrut, I'm from Romania, and I represent the Romanian Federation of Patient Diabetes Associations. So we are not the initiators of this project, but we are part of it, as everything has been done under the umbrella of the Romanian Diabetes Forum. As the Romanian Federation of Diabetes Association, we are an organization that have 23 associations, patient diabetes associations, and we are trying to liaise the efforts in order to increase the voice of associations. And at the same time, I think that we do have a very good collaboration with the professional organizations. And this actually brought us so much closer in being able to do projects together as it was this one. So just a few words about the Romanian Diabetes Forum, because actually it's a platform of collaboration that had started in Romania in 2019. And it was a partnership between the Romanian Society of Diabetes and the Romanian Federation of Diabetes. They are both professional organizations and as well members of IDF Europe. So the partnership was between these two, together with the Romanian Association of International Medication Producers, RPIM. Apart from that, they do have the support from 10 other professional organizations, mainly in the diabetes area, but also the General Practitioners Association are part of it, and also the pharma organizations, like pharmacological organizations. As well, they do have the support from 10 diabetes patient organizations. So my organization is one of them, and there are 9 others. So we'd like to think that we are the ones that works very good together, and we are the strongest and more active. So the vision of this platform is actually to be able to consolidate a medical system focused on the patient, with positive impact on education, prevention, and of course early diagnosis of diabetes in Romania. So everything started when we had a conversation, and we know that we do have a problem. So it's not only in Romania, it's worldwide, but we do know that in Romania, 1 of 10 people have diabetes, and 1 out of 3 have pre-diabetes. So we try to see why this is happening, and this is happening because we don't have information about diabetes. We don't have information about healthy lifestyle. We don't have awareness. So if we see the general population, they don't know. They don't know about education and don't have so much access actually about education in about healthy life choices. And this happens mainly because there's so many platforms, and maybe we all face this problem. There's so many people posting, and if you don't have a good knowledge of the terms, you might go into bad choices about the changing lifestyle. We don't have even education in for people with diabetes in Romania, as in we don't have the profession of educator. We have a pretty good diabetes system, as in access to medicine, and this is wonderful, but we lack education. Now the good thing is that since the national program for diabetes has changed, we do have nutrition, which diabetologists can do to people with diabetes, and we also have psychology, and we're trying so much to change the behaviors regarding choices in terms of food and exercise. Another problem is that we don't have registries, meaning that we don't know exactly how many people are with diabetes or pre-diabetes. And also we don't have enough interest from politicians. And also this is something we really struggle with, but given the fact that we are coming together, more organizations, we are starting to be more heard in terms of our problems. So we did have a lot of consultations, and here are some pictures with different stakeholders from this forum, trying actually to make a team. So trying to go in the parliament, and as well as to have conversations between, for example, professional organizations as well as patient organizations, and try to create the same voice in order to be able to send a stronger message. So then, about in the summer, autumn of 2019, we had a document that we sent to the health committee, where we were talking about the problems in regards to diabetes, and also the need of prevention for this disease. So then, happily, in 13th of November of 2020, in full pandemic, actually the prevention law has been registered at the Romanian Parliament. It was quite a joy. We were not expecting it. mainly because of the pandemic, and also because it's difficult actually to be able to introduce a law in Romania. So this prevention law, what we're trying to do actually is to be able to target multiple factors of prevention. So first, we would like to have the education area about healthy lifestyle choices, and we would like to start in schools. So basically to be able to form some collaboration with the Ministry of Education to be able to have classes in schools about healthy eating, and as well to be able to maybe change the availability of food in Romania. Given the fact that there are so many boutiques with not so healthy food, we also would like to change that, for example. Another factor is for early diagnosis and screening for diabetes, and this is something that also we don't do at the moment, to have the registries, and also to be able to create a more organized actions for diabetes and for prevention. So in order basically to have a national plan and to have the same interactions with people living with diabetes or with pre-diabetes in order to be able to give them access to education, basically. So where are we standing right now? Actually, it's with a lot of papers, meaning that at the moment it's not that we were able to have that plan that we wanted. So we are still working on strategy. The good thing is that there are so many wonderful people working on that, and we managed to have a wonderful team that also works close to parliamentaries and also in the Ministry of Health, meaning that we are really trying to have that strategy in place, so to be able to work according to this prevention law. In the meantime, the good thing is that things haven't stopped. So in all this time, so since 2020, there were more initiatives that would support the importance and need of the prevention law. We are still looking for new organizations that would like to join the cause and spread the message about the importance of prevention, and also to consolidate the relationship with the parliamentaries and the health representatives. So what we did so far, so the forum had the initiative of looking for the missing million. So 1 million is missing, meaning that in Romania we have the idea that for every person that is diagnosed with diabetes, there's still one that hasn't officially been diagnosed or doesn't know that have diabetes. So this is also like a campaign for screening for diabetes. Another beautiful initiative is actually to evaluate the risk of diabetes in pharmacies. So at this moment, so this project started in, it was between May and July so far, and there were about 5,000 people that fulfilled the questionnaire about the risk of having diabetes. And so far, there were over 20% of those that completed the questionnaire that are at risk of developing diabetes. So one is for the screening, and the second part of the project is for education, meaning that every person received educational materials on what is diabetes, which would be the healthy choices to make, the small changes in order to prevent diabetes. So this is just an image of a meeting that we had on the Parliament on the third edition of the third year of the Romanian Diabetes Forum, where we also talk about the importance of prevention, the needs of people living with diabetes in Romania, and also a call to be able to come together. So to be able to bring also the parliamentaries more and more close to us. We are also still having a lot of meetings in order to be able to put the strategy in place, and actually to make sure that every part of this platform knows what we have to do and what has been done so far. So some of the challenges of this prevention law is actually, like I said before, that it has been approved during the pandemic. And so then the focus was not on putting in place the strategy. Then there were a lot of difficulties in maintaining diabetes on the agenda, and this is something that we all struggle. It's not only with the prevention law, it happens in other times as well, and other projects and initiatives as well. There is a political uncertainty, meaning that sometimes when we just want to push things forward and we make some, let's say, friends on the policy level, they get to be changed because this is the situation. It has been difficult and still is to organize all the stakeholders, meaning that in this platform there are multiple organizations, so it's difficult to bring them all together. And of course, to be able to think about the national budgets, meaning that when implemented, the prevention law would mean that we would need some budgets in place in order to introduce educational sessions in school, to make screening for people living with diabetes, screening for people at risk of developing diabetes. So we think that it will be a challenge. What we've learned so far is that we do need collaboration. And this is something that I really loved as also a person living with diabetes and being in diabetes organizations for the past 10 years, is that we collaborate. We are talking together. We make honestly, it's like we're making friends, because it doesn't matter if, for example, I represent a patient organization and there is someone else representing a professional organization or from the pharma. We can talk about this project, we can talk about other projects and campaigns that we are doing under this umbrella, and it's quite wonderful. Also, we need to create actually a good relationship with the members of the parliament that can support our cause. And this is something that I think we all know that it's important to have this kind of support. It's also, I think, important to be visible. And good part of being so many organizations is that we send the message on all our platforms, and so people can reach out so much better. And another learning is that we do need to be very patient, because things are not going as we expected. I mean, in terms of time. So we do need to stop at every pace and just see the data of the problem, so to be able to find solutions and move on. But I think that it's incredible that we are in place of doing this, and really hope that we will be able to have the strategy as soon as possible, and then we will come with so many more challenges just to be able to implement it. So this is why I think that we really need to be patient. Other than that, thank you so much, and if you have any questions, thank you.
Thank you, Christina. Yes, I guess being patient is always a little complicated, I would say, when you know what the urgency of or the need for action now is. So yes, I think you are to be commended to be taking such a Zen attitude to the issue. So thank you very much. So I would like to now ask all our panelists to come on. And from the audience, please don't hesitate in asking questions or raising your hand if you want to say anything. So yes, I see Sari, Robert, Alexia, and Nebosha, if you want to come back on. Perhaps whilst we're waiting to see if there are any additional questions, I can start with one question for Alexia. And the question was about, can you see any trends in the engagement of people that perhaps come and visit the website for the first time? Do you see any kind of long-term impact of the campaign? So you know that you're leading the campaign, you've got more and more people that are engaging. Do you see them engage over the longer term, or what kind of feedback or like opportunities for understanding that mechanism?
About the website, I know that it was a good tool maybe a few years ago, but to be frank, now it's not that that good as it was before in the timeline, but it is still a good tool for people who wants to be tested. But yeah, I think it was more used in the past than it is now. So that's why we want to reach the audience with other ways, like in the field, with social media and stuff, because it's maybe more impactful today.
And do you have a way of seeing whether people come back or like stay engaged perhaps with other activities of the FFD after their initial contact? Or
can you repeat, please?
Yeah, so for example, if you run the prevention and you see, do you see any people that would be like being caught by the prevention campaign and then would come back and try to engage as a member of the Fédération, for example, or would be seeking to join specific programs or etc.? Are you able to follow the impact of the prevention campaign in any way?
I'm sorry, I don't really understand.
Yeah, what I'm saying is you run the prevention campaign every year.
Yes.
And so how do you see the impact of the prevention campaign? Are you able to measure the impact of it?
Yes, of course. I think that we have tools for measuring that.
Okay.
Like with the press, with press impact, website impact.
Yeah.
I don't know if I answer.
Yeah, I suppose the question was, do you see that from that campaign, people get engaged with your federation more over time?
Oh yes, I think it's a way to get known by general people, because it's a good way to get people involved in the actions of the Fédération. So yes.
Okay, that's great. The other question I think was for Robert. It's not a trick question. It's like with running the campaign for so long, do you see a change in the knowledge that people have over time? Because you know, as you're saying, the campaign is a nice way for people to share knowledge, etc. So so we were wondering whether you can see that, I don't know, people have different concerns or have more or less knowledge as the years progressed.
Okay, in every year, every 2 years, we made new questions and normally for this it's required new knowledge. It's not always the same questionnaire, so it's important to learn a lot. I was going last year through all the questions for elementary and for the national competition. I don't know if Professor Raposo know all the answers. I don't know, really. It is very difficult. It's very difficult. These questions are in so details that it's the knowledge that you must know, it's very large, and normally you must know the right answers, because some questions are a little tricky, and you must learn and read very well. Sorry, Zhao.
No, thank you. Thank you, Robert. Yeah, Joe, you will have to take that test now.
I don't, at least not in public. Let's try.
Okay, we'll save your blushes then. Thank you, Robert. And I think there was a question perhaps for Sari also about how does it exactly work, your relationship with the Finnish health authorities in running the campaign? Because you say that how integrated is your action versus the health ministries or authorities' action? Can you maybe explain that in more detail?
Yeah, I think it's working just fine. We have very close connections to, for example, the Ministry of Health and Welfare in Finland. We have a joint NCD group, which includes also the employees of the Ministry of Social and Health, in addition to our associations, and we are discussing there about all kinds of things that should be done in Finland. And for example, if European Union is going to develop something that they ask about our Ministry of Social and Health, they always pass these questions to our associations also. So they ask us how we see the situation.
Right. Okay. Yeah. So I guess it's like having managed to build over time,
yes,
that relationship, which really matters.
Yeah, but it has taken 25 years.
Well, you were being patient like Christina, I suppose, so that's good.
Yeah.
And I suppose that's the same for you, Joao, right? I suppose that building, I mean, I know what you're saying about the municipalities, but I imagine that it goes beyond that. And is it just persistence?
It's always a challenge, and I think the best lesson to take, it's never take it for granted. Even when we have long-time cooperations, things always have some hiccups during the pathway, and something that always worked well, suddenly they are not working well, either because it's a new person in the process, either because the weather is not in the right condition and people are not feeling well on that day. And we as associations, we have to know that and don't get too frustrated with that, and try to find new ways to overcome that. And I think that's one of the best challenges that we have as in that role of association to overcome, because it's really difficult. Even when we show all these initiatives, sometimes they might seem easy to put in place even after 25 years or more years, but actually, even when things seem to run smoothly, sometimes they just don't go like that. And we have to know how to involve even more the people around us, the people at local level, because even at the national government, even they feel confident with our role as a patient association. Sometimes they just forget us, and so we have to be there always and pushing them to move on. Because I think it's quite natural to know that health ministries have a lot of solicitations from other disease, from budgetary conditions, and so diabetes, in their perspective, is just one more, or it's the usual stuff. It's about healthy eating or something like that. And we have to constantly challenge them to say it's not always the same. There's no new ways to do things. We are not speaking about the same thing. And that's our role also to show that we are innovating, doing things in a different way, I think.
Thank you, Joe. And Nebosha, I see that
Yeah,
you've raised your hand.
I think Joe is much right. He has much right. Not because he's the member of, we are in the same board, but in the last 20 or even more years, the scientific community and the public health workers have produced so many documents and so many detailed scales about prevention of diabetes, and all of them, I must admit, almost died. Even in Finland, which we always looked upon as a sort of leading light in our efforts to prevent type 2 diabetes, it slowed down a little bit, not a little bit, but much more than it used to be before. So I think that at present we just would need to we don't need to write anything new almost. Maybe I would be too radical, but we are in a position to choose, and that's why these conferences are very important. Among what has been created in many countries during all these years and decades, I must say, and it is not just it is not just to persuade the people with diabetes to live healthy and to eat healthy with pre-diabetes and those ones who have I don't know, high risk for diabetes and so on. It must be a sort of concerted action of all the stakeholders in the society. That's why I think that this is very important. And on the track of the Romanian experience, we wouldn't achieve too much if that wouldn't be the part of the regular healthcare system, like treatment of diabetes, overt diabetes. Because if doctors, nurses, healthcare institutions, additional institutions, plus, of course, inevitably, associations would not make a network for the prevention, primary prevention, we would fail again. And I would always remember the Congress in Nice, not because it was Nice, but because of that it used to be the Congress on Metabolic Syndrome once upon a time. Maybe Joao would remember, and I think the others are much much have joined us lately. But and within this Congress there was a debate even before the year 2000 why the prevention failed, and it of course did not fail, but it became evident that even on 15% of the success of the prevention lies upon the healthcare system. And all the rest is the society. All the rest is this network of different stakeholders that would contribute to prevention. And that's why I think that even our task, if IDF and IDF Europe can do the miracles, but our task should be to revitalize, to choose among what has been successful in the previous years, and really try to spread it out and make it official, make it a part of the healthcare system. Otherwise, everything would stay on best case scenarios and very isolated positive results. Maybe I was too pessimistic, but I was pessimistic in order that we reach the optimism in future. I won't speak anymore. Thank you very much for joining this webinar, and in my mind, it was very successful.
Thank you very much, Nebosha, for your contribution. And I'm afraid we're now coming to the end of the webinar. So what we will do is to upload the recording on our website, and we'll also put together a summary of the initiatives that were discussed. And as Nebosha was saying, there's a desire on the part of the European Union, at least, to have this compendium of best practices. So even if you don't want to submit them directly, you can always send them to IDF Europe, and we can look at how best we can promote those best practices across all of our members and also policymakers. So I want to thank again all the presenters. These were really interesting presentations, and we look forward to seeing you again all on our next webinars. So thank you very much. Bye.
Thank you. Take care.
Thank you.
Bye.
Bye.